Welcome to InteliDOX version 5, which is now certified as a 2014 edition complete ambulatory electronic health record. This video, which is the second in a series of 4, will help you get familiar with the new features in InteliDOX version 5. In our first video, we demonstrated the changes and additions that have been made to the patient summary screen. To watch that video, click here. In this video, we'll discuss changes to the InteliDOX patient portal and new options for securely communicating with patients and other healthcare providers, including receiving and importing patient information using the standard CCDA format. In the previous video, we showed you how to use the new Portal Users section of the patient summary screen to create accounts on the portal for patients and their authorized representatives. You do that by clicking the Add link at the right side of the Portal Users section and selecting either the patient or another person. If you select the patient and their email address has already been recorded in the Demographics section of the patient summary screen, the information you need will already be entered for you. If we were creating a portal account for someone other than the patient, such as a spouse or a parent, we'd need to enter their email address, their relationship to the patient, and their name. Next, enter a word or a short phrase that will be used as a temporary password for the portal, and share that information with the patient or their representative, preferably in person. When you click the Finish button, an email will be sent to that person. They'll click the link in that message to connect to the portal, enter the word or phrase that you gave them, then enter a password of their own choosing. If they enter the secret word or phrase correctly and enter their new password the same way twice, their portal account will be activated and they can log in for the first time. There's some new information and options at the top of the portal homepage. Some of the patient's demographic information is shown just under the patient's name, and there are new options for the patient to download their information or send it to a secure direct address. For example, patients can download their healthcare data as an HTML document, which is a web page that can be viewed using a web browser such as Internet Explorer, Firefox, or Chrome. They can scroll up and down on the page or use these Jump To links at the top left corner to jump to a specific section. Patients can also download their information as a CCDA file, which is obviously not meant for casual browsing, but can be imported into some electronic health record programs. The Transmit It link lets patients send their information to a secure direct address, such as the direct address of another healthcare provider or a direct address for the patient themselves, such as the direct address that's available to users of Microsoft's Health Vault website. Further down on the portal homepage, you'll see some new sections. The Vital Signs and Care Goals sections display the same information that you'll see on those sections of the patient summary screen in InteliDOX. The Your Care Team section shows the patient's primary doctor, as well as other InteliDOX users who have made changes to the patient's record. At the bottom left corner of the page, there's a link named View Activity Log that the patient can click to see who's logged into their portal account and viewed or downloaded their information. This activity information can also be viewed from within InteliDOX using the Security Audit Report. It's easy for the patient to notify the practice about any changes that need to be made to their information. The medications, problems, allergies, test results, and care goals sections each have a Notify Us link that the patient can use to begin a new message to the practice. They can choose who they want to contact, and there's a box to check if they're requesting an amendment or change to their healthcare information. Back in InteliDOX, these messages from the patient portal will show up under this External Messages link. Because in this case the patient checked the Requesting an Amendment to the Healthcare Record box, there's a notice that this message contains an amendment request. You can review the patient's record, make any needed changes, such as marking a medication stopped or marking a problem as inactive, then return to the message to accept or deny the amendment request. Click the Click Here link, indicate whether the request is being accepted or denied, update the Decided By field if you're entering information on behalf of the patient's primary doctor, enter a brief description of the decision in the Reason field, and click the Mark Amendment Request Complete button. All messages from the portal have a Reply button that you can click to easily respond to the patient's message. Your reply will be sent back via the patient portal. This list of external messages does not include a delete button, but messages that don't require any further action can be archived so they don't appear on this list anymore. While you're viewing the message, click the Archive button down at the bottom of the window, and the message will be moved out of the inbox. If you need to see that message again in the future, use this Folder drop-down list to view messages that you've archived out of the inbox. To send a brand new message to a patient or their authorized representative, click the Compose button down near the bottom left corner of the window. Address the new portal message to either the patient or their authorized representative by typing the patient's name, then selecting the recipient from the list that drops down. By default, the message will be shown as coming from your doctor, but you can change this to a staff member if appropriate. Add a subject line, type your message, and click the Send button. External messages also include secure direct messages from other healthcare providers. Direct messages will have the word direct in the type column of the external messages list. Direct messages look much like regular email messages and may also have CCDA or patient summary files whose names end with the letter XML attached to them. Just as some electronic health record programs can read the CCDA files that InteliDOX creates using the Referrals Out button on the patient summary screen or the CCDA data file download link on the patient portal, InteliDOX can display these CCDA files with XML file names and even let you import some of the information from one of these files into InteliDOX. If you click on an attached CCDA file, InteliDOX will display the file as a web page. You can scroll up and down in the file, or click a section name from this jump list to view a specific section. CCDAs that were generated by different systems may have different sections than those shown here. For example, a CCDA generated by a hospital after an inpatient encounter may include sections like discharge instructions. InteliDOX uses the name, date of birth, and other demographic information in the file to find a matching InteliDOX patient. If it finds a match, it will show the patient's account number and display an import button. If the wrong patient got selected, or InteliDOX couldn't automatically find a match, you can use this link to select the correct patient manually. If you want to import some or all of the allergy, medication, and problem information from this CCDA into the patient summary screen, click the Import button. InteliDOX will display the allergies, medications, and problems from the CCDA next to the information that's already in InteliDOX. By default, allergies that are not in InteliDOX but are marked active in the CCDA will be imported into InteliDOX as active. Allergies that are present in both the CCDA and InteliDOX won't need to be imported, nor will those that are in InteliDOX but not in the CCDA file. If there are any allergies marked active in the CCDA that you don't want to bring into InteliDOX, be sure to select the Do Not Import option. Medications that are marked active in the CCDA can be imported into InteliDOX as active external medications. If appropriate, you can choose to import these meds as stopped external, or you can choose to not import them at all. Meds that your practice has prescribed and that are still active will not be affected. The problem list works the same way as allergies. You can either let active items be imported as still active, or you can change their status, or you can elect to not import them at all. Click the Next button to view a summary of the allergy, medication, and problem lists as they'll appear using the current settings. If you need to make changes, click the Back button. Otherwise, click Apply Changes to import the information you've selected. Close the CCDA window when the import is complete. And to close the list of external messages, click the X at the bottom left corner. If your practice receives CCDA files for several patients, your system administrator may store those in an image corral, where you can review them and optionally import them the same way you would if they'd been attached to a direct message. Click one of the file names at the left side of the screen to see a preview of the information in one of these CCDA files. To view more of the file, click Index Selected. As with CCDA files attached to direct messages, InteliDOX will try to automatically match the file to an existing patient, but you can click the link at the top of the file to manually select a patient, and you can import allergies, medications, and problems from the file. If you have any questions about these changes to the patient portal, secure messaging, or importing patient information from CCDA files, please email us at support@busynet.com or call us at area code 918-858-4440, voicemail option number 2. To see the next video in this series, which covers updates to the med screen, the new Encounters or electronic notes feature, and changes to creating clinical summaries for patients who've just been seen in the office, click here.